Dr. Chris, starting with you, some basic things regarding COVID-19. What should someone do right now if symptoms start developing?
So if someone starts to develop symptoms of shortness of breath, fever, cough, not feeling well, we would recommend that you stay at home and isolate from others in your home. If the symptoms worsen or don't go away after a few days, we would recommend calling your healthcare provider, letting them know your symptoms, and potentially using telemedicine to work with your healthcare provider to avoid going in.
And once someone has COVID-19 and recovers from the disease, how long do they remain contagious?
So we don't know the answer to that. We continue to find out more about this, but we do know that people can still shed virus after the symptoms have resolved. So we have asked everyone who has COVID or COVID-like illness to stay home for at least 72 hours after the resolution of symptoms without any medication.
How long does the virus stay on certain services, on clothing, money, cell phones, all of these things that people are asking about?
And that's been a very valid concern. So viruses are not very hardy. So depending on the environment that they're in is going to depend on how long it lives. So if it's cold and dark and inside, it could live for hours to potentially days. If it's outside in the sun and the UV and it's hot, it's not going to live quite as long.
There's been a lot of talk about when the heat kicks in. Is that going to help tamper the virus?
So it would help if it was outside on surfaces because they do not like heat. They don't like to live out in the heat. However, what we tend to see is when we get our flu seasons, which go October through April, you get people back outside. They're not sharing that same enclosed space, not touching the same types of surfaces. What we anticipate to see is because so much of the population has not seen COVID-19, we will continue to see cases as it warms up.
And those who have recovered from COVID-19, can they get it again?
So that's a really great question. Your immune system is actually designed so that the next time you see that same germ, your body responds faster and it responds better. So we believe that most people either will not be able to get the disease or they'll get a less severe course. However, we are hearing case reports potentially of people getting it again, so we continue to watch the data.
How aggressive should people be about trying to get tested if they're really concerned about their health?
I would say that if you have mild symptoms and you can stay at home just like you would normally with the flu and recover with lots of rest and fluids, try to do that. The test is not going to change how your doctor is going to manage your symptoms.
But Governor, the test would change strategy, planning, seeing where the virus is spreading, those sorts of things. Are we getting as clear a picture as we could about the virus?
We're operating with the best information and data that we have. This is why there's been such a focus on ramping up on testing. And again, we're going to prioritize the folks that are on the front lines first, but as we're able to backfill the test, we'll have more information and we'll be able to make even better proactive decisions.
And General, the question for you, reiterate please regarding tribal lands. There's a lot of concern. I think New Mexico's governor said that he's concerned that some of the tribes could literally be wiped out by this thing once all is said and done. What's being done? What are you seeing now? What do you foresee for the future?
So when we were called on Saturday, I believe all the days blend together, there was reports of double-digit members of the Navajo Nation in Tuba City that needed critical care intubation and ventilation in a facility that was very limited in its capacity. We worked through the evening with Dr. Chris' team and the rest. The next morning we flew 2 Black Hawk helicopters up there, delivered an 8-man go team and some PPE for the facility to shore up those that were there at the facility. When we arrived, there were 5 patients that were on a ventilator and 2 that ended up being ventilated by the end of the day. We quickly helped the medical team there at the Tuba City facility do great work to transport all but 3 of those patients out within the next 24 hours to Flagstaff. When we talked with the tribal leadership yesterday, the situation at Tuba City received a 14-person National Disaster Medical Support Team. They have one patient on a ventilator, but it is not untrue that the per capita outbreak up on the Navajo Nation is the highest in the state right now. While our team was there, there was a call to try to get some folks over to Kayenta. In the community of Kayenta, they do not have a facility capable of doing that level of care. So we're working with them to try to figure out how to quickly ambulance them out, either to Chinle or to Tuba City, stabilize them, and then also transport them either to Gallup, New Mexico, or Flagstaff.
Governor, you are a supporter of Child Help, and Child Help has reported a spike in calls. There is a tremendous amount of concern about stress and anxiety exacerbating kids at risk of child abuse. What do you say to that, and if anything, what can the state do to help?
Well, our Department of Child Safety, of course, has all hands on deck. This is a concern because so many of the calls that come in to help kids that are in harm's way come from our teachers, and they're no longer in school. So good actors like Child Help, of course, the social service workers that we have in state government are doing everything possible to make certain that these kids are protected, and we're going to continue to do that.
And back to the economy, if we could here in this session. Small business owners, you mentioned restaurants and you mentioned the fact that it's just terrible out there. What is your message to them? I mean, some of these folks are not going to be able to come back. Some are trying as best as they can. What are the resources? What's available to them? And what's your message?
I say, let's go to ArizonaTogether.org. In a traditional situation with this kind of, whether you want to call it a recession, a pandemic, you're absolutely right. The amount of dollars that the federal government and the Treasury floated was to keep small and medium business people afloat so that they could continue to pay their employees with forgivable grants, loans, and extensions. So yes, a restaurant, it could be the best run restaurant in the world. You can't stay alive with no revenue. In this situation, the federal government's objective is to throw that lifeline, and we want to work with all these entrepreneurs. They were all doing great before this happened. This pandemic and the decisions that we've had to make around public health have influenced where we are.
The president at one point said that he wanted to make sure the cure was not worse than the disease. That was a while back. That's before the numbers really started piling up. But is there a sense of that in the way you are balancing decisions?
Oh, no. My first priority is public health every day. We are going to do everything we can. There's no doubt in my mind that we'll come back better and stronger than we ever were. But public health takes a priority in every situation.
But what do you say to all of the hardworking small business owners who've put their heart and soul into building something and are terrified because they don't know how long they can hold on?
This is why we put so many orders out, so people would know that they're not going to lose their home or apartment or small business. This is why the amount of money is being floated, not only in the Paycheck Protection Act for employees, but also for small business owners and entrepreneurs. That's never happened before. This is completely unprecedented.
Price gouging. We're hearing stories about price gouging, especially at a local company apparently with masks. There's stories out there regarding that. I understand there's a federal law against price gouging. What's going on here in Arizona? What are you trying to do? What do you plan to do to keep this from happening?
So I want to say that in disaster like this, you see the best of human nature, and we've seen that in the ArizonaTogether.org and the contributions that have come. This price gouging is an example of the worst in human nature. So of course we're working to access whatever we need for Arizonans, and cost is something that we can accommodate in this situation. But these folks are profiteering off a pandemic, and they'll be held accountable.
I want to ask you if this report is accurate and true. Two Arizona congressmen have reported that vendors have marked up their face mask prices nearly 500% in a matter of weeks, according to these two congressmen, and that Phoenix is being asked to pay almost $6 per N95 mask compared to $1. Is that true?
Well, I have to check the facts on this from the congressman. I know that Andrew Cuomo told us that he was paying $7 a mask in New York. This is why we've been able to access our strategic national stockpile, and that's not the cost that we have right now. We also have private sector manufacturers that are changing their lines as we speak that will be bringing millions of masks to Arizona and masks for other states at a very reasonable price, 70 cents a mask.
As we stand right now, are we getting our fair share of PPEs?
We're getting our fair share, and we need more.
Okay, is there anything you can do to facilitate getting those masks, those additional masks, quicker?
Yes, we are taking state dollars, we're appropriating them forward and trying to find the product that we need at the best possible price so that we have what we need. And today, Ted, we do.
The bottom line of that question is, are we getting what's coming to us, what we need as far as resources from the federal government?
We have 75% of the strategic national stockpile, and we're going to access the remaining 25%, and then we're going to go find and manufacture more.
There have been reports of healthcare workers saying that they don't have what they need right now in various health facilities in Arizona and that they were told not to speak out about it. What do you say about that report?
Well, I want to know what's happening in real time in every situation. Just like I said, you're going to know what I know when I know it. We're going to update the website. We're going to be as transparent and urgent as we possibly can. If something's going wrong in a facility, we want to know.
What is the thing that is keeping you up at night right now, Governor? I know there's so much to think about, but what is keeping you up at night?
Well, we want to be ahead of the curve here. We've seen what has happened in other places when there has been a surge, when there has been an invasion into the retirement homes in Seattle. What I'm asking every day is, are we doing everything possible to lower this curve, to make sure that the spread is as minimal as possible, and then are we prepared so that we can navigate and get through this? That's what I'm focused on. There's other things, and I realize the very real fear and anxiety because of what's happened in the economy. Our economy is going to come back. It's going to be tough, but there's lifelines from the federal government and state government, and then we rise again. So it's more of the to-do list on public health, and I believe that we're where we need to be, and there will be additional things that we'll add tomorrow.
And last question, you are confident that you have been and are doing everything in a timely fashion?
We are doing everything with purpose and a sense of urgency, and we're going to continue to do that, focused on Arizona's situation.
Very good. Thank you so much to all of you.
Thank you. Thank you very much.
Thank you.